get dividends. Sunny is the associate editor of AIOC and a great researcher himself, and he did a lot during his residency and fellowship.
Thank you, sir, for this
DNB
opportunity.
gold medalist, right, Sunny?
Yes, sir. Okay. Thank you, sir, for this great opportunity. And so Akshay talked already a little bit about that you should go and present your thesis in a conference if possible. But you really need to invest some time and some effort into a good thesis. And it's really like learning a surgical skill. So if you're trying to learn phacoemulsification, you go through a stepwise process and then you become a good phacosurgeon. Similarly, a thesis or generally about clinical research, you again need to go through some basic steps before you get good at it. So, you really need to invest your time and energy and efforts into your thesis. So we'll discuss a little bit about that. So I usually like to, start by saying that work that remains unpublished in one form or the other is essentially incomplete or undone. So in a year in India, we have about 600 or 700 theses which are happening. So at least even if there are 10 or 15% which are very novel, so if you can realize that about 60 or 70 good theses are coming out every year. But do you think a lot of them get published? Unfortunately not. So a lot of it gets undone. We go through a lot of these processes of randomization. You do a review of literature, you spend a lot of time, you get a lot of headaches while doing a review, but then we do go through those things. We do sampling, we do data collection, then finally we do statistics. This is sort of a funnel approach where it should all come out into an article in a journal. So what we'll try to discuss today is some prerequisites for a good thesis and publishing in a particular department. How do I choose a great topic? Because that is where your novelty really starts. How do I plan and execute my study? And what do I do after the study is done? So the prerequisites basically is, sort of if there are some, if there are faculty sitting here, it is commitment of the senior staff and the desire to make it happen despite the odds, because there are lots of odds, especially in your government medical colleges and setups, but there has to be a basic commitment. Then, the need to do research without hassle and disturbing your routine. That is sometimes I hear a lot about that. Oh, there are too many patients and too many surgeries and I don't have the time to do it well. So you can actually think about employing a research coordinator for this. And then, of course, ethics committee clearance is a must under ICMR and DCGI guidelines. So this is what we've already seen. So how do you choose a great topic? I think that is something, when we are entering ophthalmology, we don't have a lot of knowledge about the subject, especially because, it's not covered extensively in undergraduation. So, most of the times I've seen, a thesis guide tells you, oh, go and get some topics for your thesis. Go get me 10 topics and I'll choose one among them. But then, so the onus really comes on you as in how you choose a topic. So how you can choose a topic is, there are some ways which I can tell you is, you can subscribe to table of contents of some of the major journals in ophthalmology, like this is JAMA Ophthalmology, then you have, Ophthalmology American Journal, British Journal, and ARVO, the main journal of ARVO, which is IOVS, and so many others, about 8 or 10 major journals which are publishing the bulk of the highly cited articles or the impactful articles. What you can do is actually subscribe to table of contents, and then you can read full text. So most good articles, so subscribe to table of contents and make sure that if you see a good topic, you pick that out and you try to read the full text articles. You may not be actually able to do that study, but most good articles conclude with what should be done next and what can be done or what can be achieved more. So you get a lot of ideas when you start reading full text. So a caveat is to start reading full texts of articles, not just the abstract. Then try to sort of establish or a teaching schedule where you have journal clubs at least once in a month. So on a regular basis, that is at least once in a month. So what you can do is learn something new from that paper, and then you can actually try and critique that paper. So what was good about this paper, what was not good about this paper. And I think this has really helped me a lot, because when you are outside into the real world, you soon notice that within 5 or 6 years, you will start unlearning things and then start relearning new things. So how do you relearn? That is how you relearn, right? You read papers which are published, you attend conferences sometimes, but the final decision is what you have to make. So unless you know how to assess the quality of a particular paper, you may find it difficult in later years. So this journal club really helps you in that as well. So then we'll look at once your thesis is done, why should I publish? What are the prerequisites? So this is basically what we have seen. How do you choose a great topic? Then you have to plan and execute the study. So it's important to do a literature review to see what has not been done. Okay, so it's very important. That also gives you a novelty. So you have seen that, okay, this is a paper that I'm interested in. These are some of the topics that I have found. it's very important to see that this should not have been done many times. So otherwise, what's the point of doing it all over again? So the particular study, this is a mnemonic which you should remember. It's called the Pico Approach. I'll talk a little bit more about it. Think about sample size and its importance, the Excel sheet, study design, your data maintenance. These are all things that you have to think about even when you're beginning. You have to involve a statistician from the very beginning, not at the end after everything is done. And if possible, you can have a mentor. If possible, you can keep communicating with them. So this is the website which you really have to know how to use well, because this is what is going to give you the answers of what has not been done. Okay, so what we do literature review is in terms of what has already been done, but then what has not been done is something that we usually don't focus on. So this is PubMed, and you have to understand how to use it. On the bottom left of the home screen of PubMed, there is something called PubMed tutorials. So it gives you very step-by-step 4 or 5 minute tips on how to use this website the best. So what you really need to understand in your study question is, what is the lacuna? Is this study really novel? And can the methodology of a previous study be strengthened so that we get more robust results? Like I said, the Pico approach basically is, P stands for population or your inclusion of your patients, I stands for the instrumentation or the intervention that you want to do, C stands for a comparison group, and O stands for the outcome measures. So these are something that you really have to think about more in detail. A lot of the times you will do a new, there is a new surgical technique which your guide is doing and that you are evaluating, but then there is no comparison group there, and it's too late in the end to get a comparison group. So as soon as you start thinking on the lines of the Pico, you will not miss that comparison group. Samples and its importance is very important, because correct sample size takes you closer to the actual truth. Hence, it's really critically important. We can't really go out and study all those 100,000 patients who have a particular disease. So you need to choose a right sample to get the right answer, so that your outcomes are applicable to the whole population who has that disease. And then, of course, data sheet or Excel sheet design, data maintenance. There are certain there are certain basic rules to enter that data in an Excel sheet. You can actually go to my website, Sengupta's Research Academy. There are certain, there is a blog entirely, of course, on how to write an Excel sheet, how to make an Excel sheet, and then involve a statistician from the very beginning. Interacting with a statistician is a tough job. You will realize it as in when you go through your thesis, and follow certain etiquettes which are very important. How do you actually communicate with a statistician is something you need to know. So this is something that we have looked at. How do you plan? Then how do you write or publish? So writing the thesis, of course, you have to submit it to the university as well as then go on and make a publication. So writing a thesis well is the key step. One of the most important steps is writing. It's like giving shape to your ideas. So this is a website which gives a lot of guidelines on how to write a manuscript. This is called the International Committee of Medical Journal Editors, or ICMJE. And all international journals, including the IGO, follows guidelines given by the ICMJE. So this is the part on the website which gives you details on preparation for manuscript submission, sending the submission. And this is the actual screenshot of the page. So you can actually go through it, what are the general principles, etc. Then remember that your manuscript is never the final draft when you've just written it for the first time. You need to give it some time to circulate it to your guide and other co-authors if there are, and then give them time to make iterations. You have a grotty first draft, a presentable second draft. Finally, it goes through 3 or 4 iterations before a final document is ready for submission. And then thesis basically involves the IMRAT format of writing, where I stands for introduction, M stands for materials and methods, R for results, and D for discussion. So this is a paper which is published, of course, now 6 years back in 2014. It's called Publish or Perish: The Art of Scientific Writing. And some of the very respected researchers like Dr. Dhananjay Shukla, Dr. Natarajan, Dr. Jyotirmay Biswas from Shankar Nethralaya have contributed a lot to making this paper. So I won't go into a lot of nitty-gritties because we don't have a lot of time. Your introduction should involve, should basically highlight the lacuna in literature. What is your question and why is it important and an interesting one? So we don't have time to go through a lot of these examples, but this is basically how long your introduction should be. It should be like 1 page of your Word document. And this is a template of how to write your materials and methods. You can go to that paper of November 2014. All of this is part of that. So you need to mention about ethics clearance and study period inclusion, exclusion, randomization or not, outcome measures, etc. If possible, make a flow plan or a flow chart I'll just show you some examples. So this is one which shows, enrollment, intervention, and analysis on your left. And this is a quick snapshot of what you have actually done. So making something like that is another one I've used in one of my papers. This is a quick snapshot. So, it's very easy for people to read and understand. This is again a template of how to write your results, where you mention the sample size, then you mention your primary outcomes, and then you mention the secondary outcomes, etc. Make your tables and figures relevant for journals. So this is a line graph which shows not only the medians, but it also shows 95% confidence intervals. So this is a more of a meaningful graph. Without those confidence intervals, a lot of this does not have enough meaning. So imagine this graph where you don't see those lines. It's just a scattering of plots. So this scatter plot without those lines don't make a lot of sense. So make meaningful graphs. And then this is again a quick snapshot of how you write your discussion. So you can actually go to that paper again, and it's very important to write your discussion well, where you are comparing your outcomes with some of the literature which is published previously. So success of your paper and also your thesis depends upon your materials and methods. I'll take just one more minute. Materials and methods, very important, is how you did that paper, then your results, and then your discussion. This is a website which you should all definitely visit. It's called the equatornetwork.org, and it gives you a lot of checklists on how to write individual types of papers. And so this is a checklist called the STROBE, or the Strengthening the Reporting of Observational Studies in Epidemiology, or the STROBE statement. This is for prospective studies which are non-randomized. This is the CARE statement, which is used for case reporting, case reports. Unfortunately, only 12% of papers which are presented at an All India Ophthalmic Conference actually go and get published in PubMed Index journals. I think that's a ridiculously small number, isn't it? So, if you do your thesis well and you go on and write it well, that number should definitely increase. So this is what we have seen, the prerequisites for a research department. How do you choose a great topic? How do you plan and execute the Pico approach, like I said, and how do you write the thesis? And remember, that we are in our comfort zones. Though we are working hard, we really get into a sort of a comfort zone where you are seeing patients, learning surgery. That's about it, But the magic really happens outside. So move out of your comfort zones, do your thesis well, invest enough time and energy, and you will find it not very difficult to actually go and publish. Thank you.
Do you have any questions, Sunny, about your thesis? Yeah, go ahead.
Go ahead.
Hello. Thank you, sir, for a wonderful presentation. I would like to ask, is it we can't publish what we have presented, or we can't present what we have published, some sort of thing?
Yeah, so when you're submitting your thesis or any manuscript to a particular meeting, then it sort of most meetings want that it should not have been published. So when you're submitting it to the say for an All India Ophthalmic Conference, you should not have already published it. So when you're sort of submitting, so like the AIOS has almost a 7-month incubation period. You submit it in May and then you actually present in February. So that is sort of a gray area. But when you're actually submitting it, that is in May, that by that time you should not have published that paper. That is generally what the guidelines are for most. And
we can do vice versa.
You can. Once you've presented into a meeting, you are free to publish that paper. So there is no restriction at all on that.
Award